My name is Mark Crockett, Chief Executive Officer for Rise Healthcare, a population health company in Oak Brook, Illinois. Appreciate your time today. I wanted to talk a little bit about Rise Health, what we do, and how we work to improve healthcare for patients across an entire population, one patient at a time. Our organization has a series of technologies that allow us to have a view into patients. And when I say patients, these are people. One of the things that I see in the world of healthcare and analytics is that there is an awful lot of talk about data, big data, small data, timely data. What Rise Healthcare does is take large data sets from a variety of payers, providers, and other types of people connected to the healthcare system, and we resolve down to the level of a patient and what does a patient need today? What decisions do they need to make? What kind of provider tools do we need to have for that patient? How do we get that patient into a place where their health is in a better place? That tends to lower the cost of care, improve the patient's interaction with the healthcare system, and it also tends to lead to better quality of care for the patient in a clinical way, which as an emergency medicine physician, I see a lot of patients that I think if this patient would have come to see me earlier, if this patient would have gone to see their primary care physician earlier, that we could have avoided an emergency department visit or hospitalization. Typically, that doesn't happen because the patient doesn't know that they should be in getting seen, and the provider doesn't know that that patient's in a place where they have needs. That's what Rise Health does, that we resolve that. Right now, most providers are seeing a number of interesting things happen in the world of payer contracts. The payer contracts are coming to them with value associated with them, whether it's alternative cost and quality contracts or accountable care contracts. At their core, they require the patient, the physician to collaborate, to change their behavior, have to take your medicine, have to lose weight. The provider has to make sure you have your flu shot, make sure you're on the right medications. These types of things require a different level of conversation with the patient. Rise Healthcare can provide the analytics that show what the patient needs, and then the in-practice workflows that help a provider know that this patient sitting in front of me right now needs something different, and if I do that differently, I get an improved payment on the patient. The patient is a happier patient and a healthier patient, and in the long run, we'll see improvements in terms of overall cost for everybody. That's what they call the triple aim, and that's where Rise Healthcare is really deep in the practices, helping payers coordinate with providers to make sure the patients get the right thing at the right time. Typically, that's driven by one of these accountable care contracts, but is even in organizations where there's no accountable care, there's no risk that the providers are at, that better patient experience, that more efficient practice where a lot more of the care team is working, that those practices are typically financially and clinically healthier. And so we've provided the types of services across the country to a number of organizations who are really cutting edge in terms of getting that done. Some really interesting stories tend to come out of that. We have heard plenty of stories where a patient was calling in to get a refill on their prescription. The patient calls in and says, I need 6 months worth of my Avandia to treat my diabetes. That is a great opportunity to say to the patient, I know you want that 6 months worth of Avandia, and I'm certainly going to get that for you, but you haven't had your flu shot, you haven't had a recent test for your diabetes, you haven't had a recent lipid panel. Those things are really crucial for your care. And so at that point, arranging for that patient to get into the practice, get seen, that type of thing can be really impactful in terms of improving cost and quality. And we have tremendous outcomes from that approach where we've been able to show that because the patient already has your number, the patient already wants to have a conversation with you, if we have that conversation when they're calling the hospital or they're calling the provider, we get to a point where we're really truly changing the way that patient experiences care, and the outcomes just absolutely have been wonderful. It's been a wonderful part of my personal practice of medicine. It's been a wonderful part of my career to see this whole healthcare environment changing and to help and to see Rise be a part of that care. For more information on this, feel free to contact us at www.risehealth.com or to send us an email at info@risehealth.com. My name is Mark Crockett. I'm the Chief Executive Officer for Rise Healthcare, a population health management company in Oak Brook, Illinois, and I'm an emergency medicine physician at Advocate Good Samaritan Hospital in Downers Grove. And I appreciate your time today. We're going to talk a little bit about getting partnerships right with physicians and getting the focus right in the relationship between payers and providers. This is something that I've been involved with for a number of years now in my position as Chief Medical Officer in the payer space, and also providing care to patients across the Chicagoland area, which is a particular passion for me. As a provider, we find ourselves in an unusual place. In fee-for-service medicine, we are paid for taking care of patients when they are sick and ill. Patients don't want to be sick, they don't want to be ill. And so, an emphasis on preventative care, an emphasis on keeping patients out of the hospital is really what the patients want us to be in. That doesn't always work under fee-for-service medicine. One of the really great things about the newer changes to healthcare, whether it be accountable care organizations or new alternative cost and quality contracts from any of the large payers, is that they bring alignment between the patient and the provider. And the patient and the provider and the payer is obviously the sort of holy grail. There are a number of barriers to that, however, and those barriers usually involve one of three things. Number one, does an individual payer have the ability to give a contract to a provider that lets them focus on the patients a different way? It also depends a little bit on the provider. Does the provider have the ability to focus on taking care of patients differently, and do their financial arrangements help with that? And then the third thing is the patient really invested and involved in this? And that's where Rise Health has done some really interesting work. When it comes to a patient behavior, what we have found is that the patients are, to a certain extent, they have a great relationship with their provider. This has been, the case for a long time, and leveraging that relationship with the provider is really important. In fact, it's been pretty well studied that patients will do what their provider asks them to do more often than anyone except family. Now, even as a physician, I would ask my wife, should I go do this? Should I take my medicine? If my wife is bugging me to do something, I'm likely to do it. That's obviously the primary relationship. Right behind that is your physician. So if a payer can partner with a provider to get the provider to say the right things to the patient, you can take advantage of that really powerful relationship, and you get the patient to do things like lose weight, like stop smoking, like go to a physician that is really highly rated on cost and quality. These are the things that really make sense for everybody. And I know that there are some physicians and even some patients who would argue, boy, if I'm getting the lowest cost care, is that really the best care? And that, I think, is something where, as a provider, I could really be reassuring, because I can tell you, if I'm ever going to get a kidney transplant, I only want one of them. I can tell you that right now. I want the highest quality procedure, and certainly that is going to be the lowest cost, is only to get one, not to get two, not to get a surgical infection, et cetera. If I'm being admitted to the hospital, I want them to take care of my problem and get it taken care of in the shortest period of time possible. So it really is true that the lower cost is also usually the highest quality, and is also usually something that the patient would see in their best interest. And so if that's one of those questions I get fairly often, but you don't have to look very hard at it to realize that lower cost is usually higher quality. But one of the things I really like about the new arrangements in healthcare is that they measure quality. One of the things that Rise Health does very well is take data sets from the payer world, from the provider world, and get all of that information together so that you have both deep information from the electronic medical record, for example, and broad information from the provider, so that we can get to a point where we understand what a patient really needs in terms of the best care. And then we can also understand, are they getting the best care? Is that person getting a statin, for example, when they need it? Is that person getting the right kind of treatment for congestive heart failure? And again, if they are getting that kind of treatment, if they're getting the right kind of medicines, that is also usually going to result in the lowest cost of care. Again, under these arrangements, quality, cost, and care are all aligned with patient, provider, and the payer. And that's a little bit tricky, getting patient, provider, and payer on the same page with what we call the triple aim. I kind of joke a little bit that the triple aim is an oxymoron. You can either aim at something or try to hit three things at once. But in the current scenario, if you are not trying to get a patient to the best satisfaction with their care, you're not spending the time with them that you need to have them understand why the lowest cost of care is also the highest quality, and try to get them to participate in your care, you're not really engaging with that patient in the way that we should. I have a very personal relationship with this issue. My grandmother was a primary care physician in Muskegon, Michigan. Obviously very early, both as a woman in medicine and in the primary care world. And she did a lot of care in her home and out of her home. And providing things where they were doing visits to the patient's home, doing a lot of home care. Under those kinds of circumstances, you have that personal touch with the patient. And she was able to get people to do things that were to their best interest and that were able to be very clinically impactful in just ways that made sense. We've lost that intimacy with the patient to a certain extent because for the last number of years, it's been hard to justify patient visits to the home and other kinds of things that get you to a really intimate relationship with the patient. One of the things that Rise Healthcare has been able to do with some of our partner practices is to allow the payers to incent the physicians to develop that intimate relationship with the patient by using things like call centers where an inbound phone call to the practice is routed to the right person with the right relationship at the right time, giving them an extremely high level of touch and service so that the patients really feel a part of the practice. We record a lot of those conversations, and so it's really kind of fun to hear things where patients are saying to the provider, boy, I don't know what you're doing over at that practice, but I really feel connected to the practice in a way that I never have before. And those are the same patients that see lower risk. Those are the patients that see higher quality on all of their metrics around the provider. They're getting their flu shots, they're getting their statins, they're getting the right level of care. And under those kinds of circumstances, everyone benefits as the overall costs of healthcare decrease. So those are some pretty impressive results, and it's been fun to be a part of those projects. It's been fun to think back and think that we're trying to take some of that really tight primary care relationship that has been something that's been missing for medicine in a lot of areas and be able to reproduce that at a scale that makes economic sense. One of the other questions I get is, as a payer, how can I make sure that I'm putting my resources into a practice and I'm getting the appropriate focus on the patients that I need to? Patients have a way of walking into the practice without a sign on their forehead that says, I am a Blue Cross Blue Shield alternative cost and quality patient, or I am an accountable care organization patient. And so to a certain extent, physicians tend to treat everybody the same way. And that is appropriate and important. But when it comes to the level of support we can add with people that we can bring into these relationships, like care coordinators, new kinds of care nursing staff that are able to attack patients directly on their quality metrics and on their behaviors. These are the kinds of things that we can make really impactful, and by targeting the patients in particular as a part of an installation of population health tools. What RISE has really found that is a dramatic difference from the past is that RISE health tools are population health management tools, but they can be integrated into a practice in such a way that the practice benefits financially, that the patients benefit clinically, and the payer benefits from seeing an overall decrease in the cost of care. And that type of approach, as opposed to some of the previous kinds of population health disease management tools that weren't necessarily as effective, by leveraging that physician relationship to get those patients into an elevated and activated state, we've applied our technology and our services to that. That's been a part of the things that our team feels really passionate about, is helping to change healthcare in a really dramatic way. I want to talk a little bit about healthcare reform. Healthcare reform has had some significant positives associated with it and some very significant and public negatives associated with it. One of the things that's come out of healthcare reform is the concept of an accountable care organization. And an accountable care organization, of course, is aimed at increasing quality for the patient of their clinical care, improving their experience, and also lowering costs. There are only so many of them in the country. I think we're up to 500 of them at this point. But the basic tenet of paying for the right thing, paying for quality, I don't think it's arguable that that's a good idea. And I think that's why we're seeing so many private payers engaging in that type of contract. And this has been a surprise to me. I've never seen in my career in medicine such a dramatic shift in terms of the way things are working. And I see an awful lot of big and small payers moving to contracts that do that type of work. It's been really dramatic. As we see those people moving, the providers are in a very interesting place. If half of my patients are being paid to stay in the hospital under a fee-for-service medicine type of approach, and half of my patients I'm paying to keep them out of the hospital, I wind up trying to ride, two horses at once. It can be a very uncomfortable position to be in as a provider to try to design strategies to get to that place. And because patients don't self-identify, you walk in the door, you don't know whether that patient is an accountable care patient or a straight Medicare patient, under which the financial rules are very different. They are really seeking tools that help them to get to a point where they can be clear about how do I take my scarce care coordination resources and put them into the kinds of activities that are going to benefit both commercially, both financially and clinically, and get to the point where they can be effective and impactful. What we usually see is once those patients can be taken care of in that way, then they would like to engage in more at-risk contracts and move along into an area where they're doing the same thing for everybody. This has been one of the dramatic shifts that we've been involved with at Rise Health, is giving people the analytics to understand exactly which patients are which model, to be able to have it integrated into the practices so that the practices on a day-to-day basis can say, on this particular patient, we need care coordination resources. We need to keep them out of the hospital for this particular plan because we're being rated on that plan, and we need to show success there so that we can get buy-in to take our entire panel and move them over to an at-risk contract. This has been truly a dramatic change in medicine, and I think we're going to see more. We're going to see more emphasis behind this as we go, and I think that it's welcome. Even as an emergency medicine physician, where you think, boy, those patients not going into the emergency room are not going to be in my practice. It's actually very, as a physician, it's great to be able to focus on the patients who truly need it at the time they truly need it. And I have seen nothing but, a positive response from the physicians and providers that we work with in terms of getting momentum around these types of contracts.